reveals that cancer incidence rates are up for both males and females under the age of 50. And these stats are even more staggering for African Americans. This morning, in honor of National Cancer Prevention Month and Black History Month, Dr. Michael Aziz is joining us this morning to raise awareness about these new numbers and to share some of the potential causes behind them. Good morning, doctor. Thanks for joining us this morning.
Morning. Thanks so much for having me.
Well, an important conversation, certainly, with these new stats. Let's dive into those numbers from the American Cancer Society. What are they and what do they reveal?
The numbers are really troubling. We have an epidemic of cancer in young women in this country. Breast cancer, uterine cancer, also colon cancer is the #1 cancer for men below age 50. And that has to do with a number of factors. The #1 reason is we have an obesity epidemic in the United States. 70% of Americans right now are overweight, and that increases the cancer risk. The #2, we're staying away from natural food, and we are following fad diets. We're eating a lot of processed food, refined carbohydrates, sugar. Sugar has a great effect on promoting cancer. And with the fad diets, low fat and low carb, which are very much in vogue, you see them in magazines and everywhere. People are eating a lot of processed meat, bacon, sausage, hot dogs. Those protein sources are full of nitrites, and nitrites damage the DNA, and that increases the risk for colon cancer.
Interesting. So now we know a little bit more about those numbers and a few of the causes behind those. Thanks for outlining those. And we also know that having a great medical care team is really important. So how do folks find the right specialists for them on that healthcare journey?
I think after COVID-19, what I've seen with my patients, that a lot of people neglected their health. You would think COVID-19 was a wake-up call for us to take care of ourselves better and go to the doctor more often. But now I see patients who haven't seen me for 4 years, and then they come back and they're like 30, 40 pounds overweight. Where have you been? Did you move out of New York? No, I was here. I was in Brooklyn. So I think the problem is we have to take a proactive course when it comes to our health. We have to be going to the doctor more often. Getting a physical once a year is not enough. That is just so antiquated. So people have to take more action and be more proactive about their health.
Absolutely. These are great points, and these and more you explore in your new book. Tell us more about that.
So I wrote this new book. It's called The Ageless Revolution, and it's the first book on the market that treats aging as a disease. Because we don't only have an epidemic of cancer in the United States, we also have an epidemic of obesity, we have an epidemic of heart disease, we have an epidemic of dementia, and the list just goes on. And the number of people that are affected by age-related diseases are staggering. Healthcare right now is all going to the doctor. You get a blood pressure pill, you get a diabetes pill, you get a cholesterol medication. And when we look at other countries that conquer the longevity and are able to live a much longer life than we do, they follow a different diet than we do. They are exercising more. Exercise is built in their daily routine. And I wanted to change the course of the health in the United States, and that was my motivation to write The Ageless Revolution, to make the country healthier, have a better improved health span and a longer lifespan.
Sounds like something I think we can all get on board with for sure. Doctor, thank you so much for that resource. If people want to check that out, where can we go to learn more, get more information?
People can go to my website, www.theagelessrevolution.com.
Excellent. Dr. Aziz, thanks for joining us today with these new numbers and solutions and great information about that new book. We'll be happy to check it out. Thanks for joining us today.
Thank you for having me.
Thank you.